I hope others in the community will follow our lead and give money to the University of Kansas Hospital and feel as good about it as we have.
You know, Deanna and I spent the first year of our marriage living in federally assisted housing. So we have seen the world from both sides. And now that we are in this position in our life where we have been so lucky, and we can start looking for ways that we can fulfill our duty to give back. And the one spot in this town, even though we've been involved in a lot of great charitable efforts, where I feel every dollar makes my city better, is the University of Kansas Hospital. We need to be in a great city. We're headquartered here. We live here. Our people prosper here. To be a great city means we need world-class health care. And we have that already in so many ways in the University of Kansas Hospital. But it is time to take the next step. And if we want Burns McDonnell to continue to be one of the best places to work in America, we need Kansas City to be one of the best places to live in America. For me, a great example of that is KU Hospital.
Greg and I both have been personally touched with people in our lives that have had cancer. And I believe that the university is a great place for people to go and get the care that they need.
But the giving efforts of one company or one couple will not be enough to get this done. And the entire city and many of its corporations will have to get behind it. And I promise you, it will be well worth it.
Kansas City is Burns McDonnell's hometown, and the Burns McDonnell Foundation is committed to the long-term success and vitality of Kansas City. There is no one better to partner with in our town than to the future and success of the University of Kansas Hospital.
We're growing anywhere from 6 to 10% in volume. So we need extra capacity. Some people still think that the University of Kansas Hospital gets money from the state of Kansas. We don't get any money from the state of Kansas to help us in these projects. And so we're really dependent on what we have in the bank. We're dependent on what we can generate through day-to-day operations, and we're really dependent on philanthropy. We'll have about 600 new jobs that we will create when we have the fully completed tower. We're going to be bringing patients in from all across the country. Well, they're going to have a place to stay. Family members are going to have a place to stay. They're going to eat. So there's going to be additional monies coming into this community for our retail business. And then we also are going to have local contractors and others who are going to help us build the building. We have proven we're a destination for healthcare. People want to come to KU for their healthcare. We've got to make sure we accommodate those populations.